Please be aware that this animation shows the anatomy of the upper airways only in an abstract manner. The nose filters, humidifies and warms the air inhale to prepare it optimally for further processing in the lungs. In healthy persons, the cavities are coated with a thin layer of mucus. This layer of mucus catches foreign bodies, much like a flycatcher. The tiny hair, known as cilia, transport foreign bodies back out of the nose. What happens when this cleaning mechanism is out of sync? Allergies, infections, exposure to toxic substances and hormonal disorders, for example during pregnancy, cause swelling of the mucous membrane. Using decongestant nose drops over a prolonged period causes the mucous membrane to dry out and destroys it. The natural cleaning mechanism, for example sneezing, is no longer able to rid the nose of the foreign bodies. This leads to narrowing or even to a partial or full blockage of the upper respiratory tract, which inhibits the transportation of mucus out of the nose. In the worst case, liquid remains trapped inside the cavities. This in turn causes increasing pressure and can lead to head and/or jaw pain. This clinical picture is known as acute sinusitis. If this condition lasts for more than 2 to 3 months, it is referred to as chronic sinusitis. When the RC-Cornet plus nasal is used while breathing out, the nose equalizes the pressure from the front part of the nose to the nasal pharynx. Breathing out causes a vibrating air pressure. This, in turn, helps dilate the airways. The pressure equalization can open up blocked areas again. At the same time, the vibrations liquefy the mucus. Thanks to the integrated nebulizer connection, the RC-Cornet plus nasal enables simultaneous respiratory and inhalation therapy of the upper respiratory tract. This improves the delivery of drugs during inspiration and reduces the duration of treatment. In the middle position, the device creates mobilizing air pressure that alters the structure of the stubborn mucus. The strongly vibrating pressure, which then drops suddenly, loosens the stubborn mucus from the lining of the cavities, breaks it up into smaller pieces and liquefies it, thus making it easier to transport the mucus out of the nose. It also helps reduce dry cough and bronchial hyperresponsiveness as the flow of mucus from the nasopharynx decreases. This also reduces irritation of the bronchi. Blowing one's nose with a tissue should be avoided. Once the mucus has been effectively removed from the upper airways, the swelling of the mucous membrane usually subsides and breathing through the nose becomes easier. Please note that the respiratory therapy with the RC-Cornet plus nasal should be carried out regularly in case of chronic complaints. Only a clean and 100% humidified nose is able to ward off infections. The course of the treatment is not foreseeable in patients with a strong tendency to develop polyps.